Hi there, my name is Chris Harkins and I work at the Glasgow Centre for Population Health. Recently, the GCPH commissioned communications and framing expert Nicky Hawkins, working closely with Teresa Burke from Glasgow Disability Alliance, to help us better understand how disability and disabled people are spoken about across Scotland today. I want to say a genuine thank you to both Nicky and Teresa. They brought not only incredible skill and expertise to the work, but also a profound insight, compassion and humanity. And one thing became very clear: when we speak about disability, the words we use matter. They matter enormously, because language shapes how society thinks about disability. It shapes perceptions, it influences how politicians speak about disability, how the media reports it, and over time those narratives can influence the decisions we make as a society and reinforce the policy decisions that affect disabled people's lives. As Scotland enters a new political cycle, this feels like an important opportunity to rethink how we speak about disability and disabled people. And what our analysis found was that disability is often framed in two dominant ways. Disabled people are spoken about either as an unsustainable burden or as vulnerable people. And although these framings are often very different in intention, evidence suggests that neither is particularly effective at building understanding, solidarity or support. Instead, these can reinforce distrust, pity, misunderstanding and a sense of them and us. But disability is not them. Disability is part of being human. The evidence tells us most of us will experience disability at some point in our lives, sometimes temporarily following surgery, serious illnesses or injury, sometimes permanently. Some people are born with disabilities, others develop health conditions later in life, and disability is also part of the natural ageing process. Scotland's census tells us that over a quarter of people in Scotland live with a long-term condition or disability. In some communities in Glasgow, that figure is over 40%. So when you really stop and think about it, disability is normal. It's part of life, part of families, communities, workplaces, society. Yet too often the language around disability creates distance, it creates othering, and we need to move away from that, because these damaging ways of talking about disability are not in keeping with the values we say matter in Scotland. They are not aligned with human rights or equalities duties. They are not aligned with health and public service policies or strategies, all of which promote dignity, inclusion, participation and respect for everyone. And if public health is serious about reducing inequalities and focusing more on prevention, then disability cannot sit at the edges of policy thinking. Removing barriers to healthcare, improving access to services, making screening programs 100% disability inclusive, and supporting disabled people to participate fully in society. These are not side issues. This is prevention, this is reducing inequality, and this is better public health. Our report offers practical ways to speak about disability differently, more humanely, more accurately, more inclusively. Because as I've said, words can divide people, but they can also bring people together. The report links are in the comments of this film. Please take a look, and I would encourage all of us to think differently and speak differently about disability and disabled people, because disability is part of being human, and every person deserves dignity, respect, opportunity, and the chance to fully participate in society. Thank you.